Delayed diagnosis is one of the biggest problems with appendicitis in children, and it often happens because parents believe common myths about the symptoms. Let me show you what's actually true. Hi, I'm Dr. George Kampouroglou, pediatric surgeon. I see these delays happen and they lead to ruptured appendix, longer recovery, and avoidable complications. Today I'm clearing up the 5 myths that cause the most confusion, so you know exactly what to watch for. Myth number 1. Appendicitis pain is always in the lower right side of the belly. Reality: in most children, appendicitis pain actually starts around the belly button, vague, dull, and hard to pinpoint. Only later, sometimes 6 to 12 hours later, does it move to the lower right. But here's what makes it even more complicated. The appendix doesn't always sit in the typical position. In some children, it sits higher, lower, or even behind other organs. When the appendix is in an unusual position, the pain can appear in unexpected places, or it can be atypical, and sometimes in the back, sometimes higher up, sometimes more central. This is why even experienced doctors can be misled. What to watch instead? Any persistent belly pain that gets progressively worse regardless of location. Second myth: if there is no high fever, it's not appendicitis. In reality, early appendicitis usually causes no fever or just a mild temperature, maybe 37.5 to 38 degrees Celsius. High fever typically appears after the appendix has already ruptured and the infection has spread inside the abdomen. So parents who say, "My child has no fever, so I'm not worried," that's exactly when you should be paying attention to other signs. So the key is, don't let the absence of fever reassure you if other symptoms are present. Third myth: if my child is still eating and drinking, it can't be appendicitis. What happens in reality? Some children with early appendicitis will still nibble on food or sip water, especially if distracted. What matters more is whether they have lost their appetite and seem uncomfortable after eating. I've seen children eating breakfast and be in surgery by afternoon. Better indicator is loss of appetite combined with persistent belly pain. Fourth myth: the blood test will tell us if it's appendicitis. Blood tests show inflammation, elevated white blood cells, elevated CRP, C-reactive protein, but this can be elevated for many reasons: a virus, a chest infection, even stress. And here's the confusing part: some children with genuine appendicitis have completely normal white blood cell counts. Experienced doctors rely first on the history of your child and the physical examination. Blood tests just add supporting information. They never make the diagnosis alone. Myth number 5: appendicitis always starts suddenly with severe dramatic pain. In most cases, the pain builds gradually over 12 to 24 hours. The child feels vaguely unwell, maybe a bit queasy, then develops dull belly discomfort that slowly worsens. It's this slow build that confuses parents. They think it's just a stomach bug and wait. Red flag: pain that steadily worsens over hours, not minutes. So here's what really matters. If your child has belly pain that lasts more than 4 to 6 hours, get worse instead of better, makes them walk hunched over or lie very still, causes loss of appetite, is persistent regardless of where it's located, or they vomit repeatedly, then they need to be properly examined regardless of fever or blood results. Trust your instinct. If something feels wrong, get it checked. These myths delay care and lead to complications that are completely avoidable. If this video helped you see appendicitis more clearly, subscribe to Kid Surgery with Dr. George. I'm here to turn worry into understanding. And share this with other parents. Most still believe these myths. Take care. See you in the next video.